kasama din natin si Dr. Adonis Gascon. Siya po ay isang neurologist, tapos pag-uusapan natin yung tungkol sa aneurysm. So, tatanungin natin si Doc, ano po ba itong aneurysm na ito?
Aneurysm, basically, ano siya, weakening siya sa artery natin. When you say aneurysm kasi, it can refer to any weakening in the wall, in the arteries of any part of the body. Pero yung common connotation niya, when you say aneurysm, is that it's in the brain. So, pero meron talaga siyang name, cerebral aneurysm. So, cerebral is brain.
Bakit nagkakaroon ng aneurysm?
Up to now, that's the main topic ng research ng neuroscientists. Pero so far, they haven't pinpointed ano talagang nagkakos, but they have identified several factors that may predispose yung
Like what?
contributory.
Yes.
The main so far is hypertension.
Okay.
Doc, we have an image here.
Yes.
Ano po ang, ano po yan? Ano pong...
Basically, this is CT angiogram. This is the diagnostic tool, the most common diagnostic tool that we have now in order to find out whether a patient who comes in because of suspected aneurysm really has an aneurysm or not. Parang yes, no.
Okay.
This is the fastest exam available right now. It's CT angiogram. It's like a CT scan. Pero CT scan kasi you look at the brain and the bone. Ang CT angiogram is you look at the blood vessels.
So, Doc, pwede po kayo tumayo para
sure.
ma-explain natin, no?
So, from the heart, diba, you have the arch of the aorta, and then you have the two main blood vessels, the carotid arteries going up into the brain. Once it enters the brain, the common carotid becomes the internal carotid artery. Ito is from the neck going up, and then it splits up. This is the aneurysm here.
Kasi
So
parang
the
may
blood
swelling.
vessels kasi it should be smooth and flowing, di ba? Usually, the main characteristic of aneurysm, kung saan nagsasanga, kung saan nagano, doon siya nagpo-form. Kasi whenever the heart beats, di ba, the pulsatile flow, you can imagine from here, ating straight, di ba? Dito na tatamaan ng blood, yung force ng blood, di ba? So over time, dahan-dahan na lolobo. If there's a weakening in the wall.
Pero Doc, bago niyo sila i-examine, meron ba tayong signs and symptoms na mayroong aneurysm yung isang tao? May pain ba yan?
Very, very good question. Unfortunately,
Wala.
the first time that you find out that you have an aneurysm is kailan pumutok na. So it's like a time bomb. So there's actually no way for you to detect kasi most of the tests used to detect it may konting risk, may konting side effect. Di ba? It's not harmless, basically. So it's used, and it's quite expensive. So it's used just to say, everybody, you do a screening test for aneurysm or not. 5% of our population harbors an aneurysm.
So is it more common on male or female? Kasi di ba sabi mo it's related to hypertension also.
Unfortunately, there's a preponderance for female. 2:1. Dalawang babae, isang lalaki. 60-40 ang ratio. They haven't really pinpointed why, but yun yung lumalabas. Plus, the height na pumuputok is 6th decade, 60s. Nagsisimula yan, mga 50s, pero kung kailan pumuputok is
Doon na po.
in your 60s.
So, Doc,
yung
you
tools
have
po.
equipment dyan, and the equipment na dala for us.
Yeah. And
Paki-explain po sa amin kung ano yan.
yeah. Usually, when you have an aneurysm, it cannot be treated by medicines. So there's a weakening in the wall. So parang nagkakalobo and then it bursts. So they estimate 10 out of 100,000 population ang pumuputok every year. So if we have 100 million Filipinos right now, yun yung latest estimate, diba? So 10,000 Filipinos will have a ruptured aneurysm each and every year.
Wow.
Pero the actual incidence, yung talagang merong aneurysm yan, is 5% of the population. So 5 million Filipinos have an aneurysm, but only 10,000 every year ang pumuputok. So it's a very small percentage. But if you're the person na naputukan, grabe yun.
Doc, ang tanong ko lang,
So there are only, like I was saying, there are only 2 ways actually to treat an aneurysm. Pumutok na siya eh. So the main cause of death is yung how much blood ang lumabas. So may mga swerte, konti lang. Yun yung
Then you can
nabubuhay.
still
Basically,
save them,
yes. Yung grabing, yung sobrang daming lumabas, of 10 patients who have a ruptured aneurysm, 3 patay na. Hindi man lang aabot sa hospital.
Yeah.
So about 6 or 7 na dadala sa hospital.
Okay.
Unfortunately, out of those 6 or 7, despite all efforts, surgery and everything, kalahati will either die or become vegetable.
Yeah, I can understand that, you know, if I can just share my experience yung from my lola, my dad's mom. She was just so happy that morning, tapos parang yung nagabihan na, she's dead because pumutok pala yung brain aneurysm. So that quick, ano?
Yes. So yeah, 3 or 4 patients don't make it to the hospital. The actual mortality rate of an aneurysm is about, it's one of the deadliest diseases of the brain. So it ranges, depends on what causes it, no? Kung hypertension, mga 40 to 50% ang chance na mamatay ka. If it's because of infection, pwede din infection mag-cause ng aneurysm. Mas mataas, between 60 to 90% mamamatay.
So what happens now, Doc, after, let's say for example, na-save natin yung
Nakadating
pasyente,
sa hospital,
nakadating sa
yung 6 or
hospital.
7,
Yeah.
no, out of 10.
Yeah.
So there are only 2 ways to cure it. One is either you apply a permanent clip on the balloon, on the aneurysm, para hindi na lumabas ang blood.
Oh my gosh.
Or from inside the artery, you fill up the balloon with the platinum coil. Parang it's like as thin as hair, pero it's made out of metal, platinum.
Okay.
So,
Ayun, Doc, may si
Would you,
Lito.
Hello.
use
Lito.
My
Meron
friend.
dun sa
Hindi
taas.
makikita eh.
Ay, di ba?
It should be
Sa
here.
taas. Yeah, you
I
can
don't know if
open
we
it.
can,
Yes, you can open it.
Ano ba to? Lito, cooperate, please.
Yan, si Lito.
Don't
Doc,
you
si Lito,
embarrass
by
me in
the
front
way.
of a doctor.
Yan.
Ayan. Ayan.
Ayun.
Ayan, Doc.
So the at the base of the brain is usually the location of the, if you'll notice, from the neck, the arteries here come out in this area. So it's basically at the base of the brain, a majority where the aneurysms can be found. So you can just imagine. So if you do surgery, it's either from the side, depends on the location, but most commonly it's in this at the side, the temple, or sometimes I do surgery dito sa kilay, through the, para hindi halata. Yeah, para matago yung scar. So you pass through either here or here to get at the base of the brain and apply this clip. Yan ang actually
Parang
this pag gold.
staple siya, no?
Yeah, may color coding kami. Pag gold, this is temporary. It's meant na to block the source of bleeding muna while you apply the permanent. The permanent is usually colorless or stainless steel or something. This is historical lang. This is one of the earliest clips. I was fortunate in my early career to be able to come across this. Actually, kasi di ba pagka bagong graduate ka, wala ka pa naman ganun.
Mga gamit, yeah.
So I was in Daum minsan, nung nandyan pa yung US base.
Yeah.
Ayan.
They were selling this. They didn't have any idea what it really was. So, oy, jackpot. Well, anyway, so that's where I got my first
Mura
equipment.
pa yan.
They didn't
Kasi
know
hindi
what
nila
it
alam
was.
eh.
hindi alam.
Dok, may katanungan ako.
Sige,
Sige. Itong aneurysm ba, may namimili ito ng edad?
Yeah,
Yes.
the most common age na pumuputok is age 6 decade, 60s. Pero it starts na pumuputok mga 50s. Yung mga minamalas, 40s pa lang pumuputok na. Like I mentioned, we mentioned in passing earlier, the main identified reason kung bakit nagkakaroon ng aneurysm is hypertension.
Doc, meron ka daw actual
this is the
operation.
actual, yeah.
Can you share it with us?
This one is the coiling, yung sinasabi ko. This is like we discussed kanina, diba, internal. This is the aneurysm. Yung itim na yan is the platinum coil. Na isa-isa na through the artery, no? From the femoral artery, there's a catheter that's guided through the aorta, inside the brain. From inside the artery, dun isa-isang nilalagay yung platinum coil. We call that coiling of aneurysm or embolization of aneurysm.
How many can you put until you can say
Until
the
mapuno.
mapuno?
Because if it's not filled up, magdudugo pa rin yan. So you need to obliterate the space of the aneurysm. That's why this is a little bit more expensive than...
I
This is
can
the safest. No?
imagine.
There are only 2 methods. This is safer than open surgery, but it's a little bit more heavy on the pocket. So each coil roughly, from the manufacturer, each coil is about 50,000. So you can imagine yung markup ng hospital. So if you need 2 coils, 100.
100
If you
na
need
yun.
4 coils,
Plus
200.
handling fee, VAT, etc.
No. Yung catheter that you insert from the groin to put it is 100,000. Yung catheter, yung highway na dadaanan niya, plus the coil, bibilangin mo ilan. Plus yung
Sakit
gumagawa,
mayaman pala.
plus the anesthesiologist,
Yes.
They do
And
this
then
in PGH.
ICU.
So it's not really, but
Doc,
of course.
I have a question. Like,
Oh, this is the actual. This is one of my actual patients. Actually, this nalagay na yung clip eh. Kanina, the picture showing the actual
So, may
aneurysm
assurance
before.
na kapag meron
Oh,
na
yan,
siyang
ito.
coiling, hindi
This
na
is the
babalik
aneurysm.
yun.
Yan, ayan.
This is the main artery. This is a posterior communicating artery aneurysm. That's the optic nerve that leads to your
Oh,
eye.
wow.
Ito. Magkatabi yan eh. The internal carotid. This is the aneurysm itself. Tapos yung clip kanina, yung kita mo na.
Diyan nilagay. Doc, what's the prognosis? Let's say a patient comes in, comatose already.
When you say comatose, medyo tagilid na yung laban
So
niya.
you don't recommend already to
No.
do, say,
We still
clipping
try
or
to do
anything?
everything to...
Yeah, but when you do that, do you do craniotomy also? So cranial
Basic-
plus clipping or the
Yeah,
coiling?
there are only two methods of treating the aneurysm. Craniotomy is the surgical way, open surgery, and then coiling of aneurysm through inside the blood
Inside
vessel
the
is the
blood
other way.
Oh, okay.
So, to give you an idea, there are about 120 neurosurgeons, board-certified
Yes.
neurosurgeons in the Philippines, serving a population of 100 million. So, mga 1 is to 800,000.
Correct.
Mga ganun. But ideally, they recommend internationally, the ratio should be 1 is to 500,000 or even better. Dapat.
Lesser.
Oh, so, kulang pa tayo ng neurosurgeons.
So pagka ganun na, Doc,
But, and then so, not all the 120 are...
able to.
well, that's a polite way of saying it.
Yeah.
So not all of them do aneurysm surgery. Of that 120, only 3 are doing yung coiling. And of the
Where
3,
are they found?
all 3 of
Asian,
them
St.
are here in
Luke's,
Metro
Makati
Manila.
Med.
All 3 of them are in Metro Manila. One is in PGH, one is in Makati Med in Asia, and another is all over.
Doc, Doc, may question lang ako, no? I understand na sinabi mo kanina na walang parang symptoms, no?
Yeah.
It happens, you know. Pero meron bang prevention na, like for
yes.
example, after ng surgery?
No.
Meron ba? Or may prevention before?
Lifestyle change before any... it's a time bomb. Okay. So of 100 million Filipinos, there are about 5 million Filipinos walking about who have an aneurysm. But it's not a death sentence. Of that 5 million Filipinos, only 10,000 will have a ruptured aneurysm each and every year. So it's a 0.01% or something. So it's,
You have to maintain your blood pressure at a normal
not maintain.
level.
You should lower. You should be sure that your blood pressure is less
Normal.
than 140 over 90.
Yeah.
140/90 ang cut-off natin dati. Dati 150 over 100. So they found out na 140/90 is already delicado. So you need to make sure that your blood pressure is 139 over 89.
You mentioned, Doc, lifestyle change, no? For example, athlete to, tapos nagkaroon siya ng surgery sa aneurysm. Makakabalik pa ba siya dun sa sport niya or tama na?
It
That's
depends on his condition coming in. Like I told you, so we have 10 patients who have a ruptured aneurysm. Sa 10, 3 patay on the spot or on the way to the hospital. So 7 lang dadating sa hospital. Sa 7 na yan, despite everything that you do, 3 mamamatay or comatose. So only 4 will survive. Of the survivors, only 2 or 3 ang parang walang nangyari. So, ganun ka.
Going back to my question, kung comatose na, dinalhin sa ospital, tapos na-operahan, what is the prognosis of that? How many of those would regain, say,
Good
yeah,
lifestyle,
good-
20 to 35% only.
wow.
It's a very deadly disease.
Yeah.
Pero Doc, ang question ko po, minention nyo nga na merong 2 or 3 dito sa mga pasyente, parang walang nangyari.
Yes.
Gano'ng
Yun nga.
katagal po ang recovery period nito?
If it's
Pagka kunyari
coiling
nalagyan na-
if it's coiling, yung only remembrance mo na ginamot kayo is may tusok yung femora dito sa ano mo eh. So they put a sandbag there for 6 hours eh, no? So that's your only remembrance. So those people who undergo coiling, medyo mas mabilis ang recovery. They also undergo general anesthesia, but the recovery time, let's say 5 to 7 days. You're out of the hospital, you're up and about. If you do surgery, you have to be in the hospital between 1 to 2 weeks. May remembrance ka na may hiwa.
scar.
The stitches need to be removed after 2 or 3 weeks. The recovery time is 1 to 2 months.
Okay, after naman po nito, meron po ba silang regular check-up? Dun
Yes.
sa kanilang, meron pang
Kasi, di ba,
scan,
the main purpose of doing either surgery or the coiling is to make sure na yung aneurysm is completely excluded from the circulation. So yung clip, not all surgeons put the clip in its proper place. So, di ba, kung wari may neck yan, some medyo may maiwan na konti
Yes.
for whatever reason. Kasi during surgery, this is such a very small field, no? We use a microscope and everything. It's part of the limitations of this kind of treatment. You need to document that the clip has totally cut off the
Circulation.
from the cerebral circulation. So, dati, they used to advise after craniotomy, after clipping of aneurysm, mag-angiogram ulit, something like this, to prove na hindi mo na makita yung aneurysm. But they found out that the risk of doing an angiogram medyo mas mataas kesa yung risk, kesa yung benefit of picking up the small percentage of patients na hindi ganun kaganda yung pagkalagay. So, if you do angiogram on all patients who do clipping, may mga pasyente na mas lalala pa because of the side effect of angiogram compared to the few na matutulungan mo na dahil hindi nga maganda yung pagkalagay. So, they do not really recommend doing angiogram on all patients. So, you may do it 6 months or so down the road to really find out if it's completely closed or not. Because if it's not completely closed, you need to readjust the clip to close it properly. That's for surgery. For coiling naman, they also recommend na 6 months or 1 year after the procedure, you do a repeat angiogram to find out na puno pa rin. Kasi sometimes, there's compaction eh. Kasi di ba tuloy-tuloy, every beat of the heart.
Yeah.
So yung pagkalagay mo, akala mo puno, nako-compress din yan kahit papano. So there's part of the aneurysm na parang na exposed pa rin. So baka kailangan dagdagan ng 1 or 2 more coils dun sa...
Doc, si colleague ko, si Congressman Henry Coangco, died of an abdominal
Yes,
aneurysm.
that's what we were discussing earlier. When you say aneurysm today, it can be in any artery of the body. Mas deadly pa yung triple A yan.
Triple A.
Abdominal aortic aneurysm. Meron din thoracic aortic aneurysm. Those are actually more deadly than
Sa
the
brain.
brain. Kasi doon, majority, pag pumutok yon kasi nga, it's the main blood vessel. You bleed out. Basically, your 5 liters of blood occupies
Is in your cavity.
the cavity. So it's may pag-asa ka pa na umabot sa hospital with the cerebral aneurysm rather than ruptured.
But those ones can be detected earlier
Yes,
because
they
sometimes they
may
have
pain.
abdominal
Correct,
pain or
chest
chest
pain,
pain.
correct.
So they can
Compared
detect.
sa head.
Sa brain, wala.
Actually, alam mo sa medicine, walang 0, walang 100.
Yes.
You never say never in medicine. So there are always exceptions to the rule. So there's something tinatawag na sentinel headache. Yung dahan-dahan nagli-leak. So nag-headache ka na dati naman wala kang ganyang klaseng headache. But not everyone will recognize it as such. Some will say, stress lang yan or whatever.
Yan.
So maski na binibigyan ka na ng clue, hindi rin nagagamit yung clue. Di ba? Until actually pumutok.
Yes, yes,
Pag pumutok yan, that's the worst. Yun yung description ng aneurysm. That's the worst headache in your entire life.
Doc, saan ka po ba nila pwedeng makontak?
Just in case they
Sa
want to know
yeah.
more about aneurysm, magpa-consult sila sa'yo.
Basically, I used to go all over, but now I just limit myself to Asian Hospital in Alabang, and I'm a volunteer neurosurgeon at the AFP Medical Center here in Biluna. I used to be with the military. I was in service for 15 years.
Wow.
Okay.
Kaya lang, I need to pay the tuition of my 3 kids, so I had to go into private practice.
Alright.
You didn't practice PTH?
No, I did not. I did not.
Alright, thank you so much. Nakasama po natin this morning si Dr. Adonis Gascon. Isa po siyang neurologist. Thank you so much,
Neurosurgeon.
Doc.